Hello, everyone, and thank you for joining us today on LNC Talks. As many of you are probably aware, my name is Tim Kane, and I'm the president and CEO of Medical Legal Connection. And my firm is a firm of various medical providers that provides medical legal services to law firms around the country. This is a little live stream I like to do to talk with other nurses, medical providers, attorneys about any medical legal issue that's out there. Today, I have a very special guest who's joining me today. Her name is Erin. Erin, how are you?
Good, Tim. How are you?
Yes. Erin, where are you in the country today? I'm good.
I am coming from Indianapolis area, just a suburb north of Indianapolis, Indiana.
So, fluff first. Are you a Colts fan?
I am not.
Oh, wow.
I'm not. I know I'll probably get a lot of heat from that, but my husband is from outside of Chicago area, like northern Indiana.
Right.
So he's a Bears fan. So
that's where the allegiance is to Illinois.
Well, just the Chicago Bears and Chicago White Sox for my husband and my boys. I'm a Red Sox fan, so.
Oh, that gives you a little retribution.
Yeah, there we go.
Yes. I'm about 4 miles from the Buffalo Bills stadium.
Oh, okay. Yeah.
I could hop in the car and be down at the stadium in less than 5 minutes. So,
wow,
we're nuts around here.
Yeah, I bet. I watched several of the games this past year. So,
Western New York is the land of brokenhearted sports fans. That's what they say. So anyway, so Erin is a nurse out in Indiana who took my course on defense medical exams and having a RN attend IMEs, DMEs as a witness. And one of the perks of taking my course is you get to be on this show, and all the attorney connections that I have and all the other LNC connections I have, you get to you get the exposure to, and hopefully some more work happens. Tell me a little bit about your nursing career.
So I went into the field around 2009. I worked on a transplant floor, so multivisceral transplant. We also did urological surgeries and just like post-surgical care. And then I transitioned down to the ER. I was there for about 6-7 years, and then transferred to the ICU and worked there for a couple years. Took a break and then went back to the ER for a little bit and then stepped away from bedside.
We're all burned out, and I get that. And that's why this is a great avenue to take for a nurse to kind of walk away from the bedside a little bit and that overwhelmingness and go into a new avenue as into the legal world. Yep. But ER to ICU, I think we were chatting on the phone yesterday. That's I think those are like apples and oranges. I used to, as an ER nurse, I don't want to say, I'm going to offend some ICU nurses out there if they're listening. And anybody, if you have any questions or comments, you want to talk about anything LNC, DME, put them in the chat and I'll put your name up. I used to hate calling report to the ICU from the ER, because we would be having this train wreck of a patient. We're getting them stable and we're sending them up to the unit, and I've got to answer questions on urinary output. Is there any stage 1 decubitus?
Right.
I mean, and those are all great questions, but it's just like in that chaotic, alligator pool that we're playing in, we don't always get to that. So I would call like med surge or this and that. They'd be like, okay, but if I'm sending them med surge, they're very stable. So it's
right.
Not as a big deal, but that's always my pet peeve of the ICU, because it just seems like ICU nurses and ER nurses are just not cut from the same brand. That's just my opinion. No,
No.
not your opinion. Not anybody
Yeah,
else.
no, it's I think it's I mean it's true in a lot of ways. There were definitely some things that I, as an ER nurse before going into the ICU, I was like, I don't understand. And then, you work the ICU side and you're like, okay, I get it.
You get it because
Um,
you're in their shoes. Yeah.
right. And
Yeah.
then going back to the ER, there were definitely some things that I did a little bit differently to like help that transition a little bit better. I mean, it was just little stuff, but um, the whole point of the ER is to get them stable and get them to where they need to be cared for.
I would say ease on down the road.
Yeah.
We got to get them down the road, no
Yeah.
matter what kind of, shape it is. LNC wise, any like, did you, take one of the big courses out there? You could say their name. You don't have to either way. It's fine.
Yeah. So I actually had looked into being an LNC several years ago. And so I kind of did, looked into a lot of different programs, and I ended up going through Duke University's legal nurse consulting program. And so that was like we met weekly, like live over Zoom with, I guess I don't want to call them professors, but they were legal nurses in the field who were actively working. And then it was about 4-month course, and then finished last April.
Nice.
And then, yeah.
You were telling me you've done some subcontracting already?
Yes. Yeah.
Why don't you tell me a little bit about that you're comfortable with?
Yeah, so I subcontract. I have 2 different contracts out right now. One is primarily a personal injury. So I review records, do chronologies for them, point out anything that might be harmful for their case or helpful for their case. And then my other contract is mass tort. So I'm reviewing medical records, essentially screening them for very specific things.
Mass torts is an interesting avenue for LNCs. I considered it a while back. It just didn't work out so much for me. But like I mentioned before we got on the show here, that Las Vegas has, oh geez, I told you, don't worry about your dog. Guess what? My phone's ringing. Las Vegas has a conference 2 times a year. It's Mass Torts Made Perfect. And there's a lot of attorneys there that, that you can network to. And there's a lot of even like seminars and live courses for paralegals that help nurses. It's just something, if anybody's, besides yourself, I'm talking to in the audience here, that if they're considering mass torts, I don't need an excuse to go to Vegas.
I know. I haven't been to Vegas in a very long time, but
but it was really, the one I did go to, I had a lot of fun, for Mass Torts Made Perfect. So anyway, so you finished your course last April.
Right.
Here's the hardest part, and this is to you and any of the other LNCs out there that want my opinion. Marketing is so difficult. It's the hardest part of this whole business. We all went to nursing schools, BSNs, MSNs. Word business never came up. So that's something that none of us have any experience at. Have you, can you elaborate a little bit on what kind of marketing, if any, that you've done, or anything on the topic?
Yeah. So one of the last sessions that we did for Duke is we actually worked through a business plan, and they, gave us all sorts of ideas on how to market ourselves. As far as my personal, what I've done, I did a lot of reach out. I'm in a couple Facebook groups for legal nurse consultants. And so I kind of just went through and see who had posted fairly recently about needing subcontractors. And I guess just to back up just a little bit, I didn't want to market myself solely as my personal company without having experience. I want, when I'm ready to take that step, I want to confidently be able to say, hey, this is what I can do. This is, I have work product. So I could feel comfortable in what I'm speaking to.
You want to have some authority on it, you feel.
Right,
Yeah.
right,
Not
right,
a fake it till you make it, which
right.
honestly, there's nothing wrong either way, but I know what you mean though.
Yeah. I mean, they tell you that when you first become a nurse, like fake it till you make it.
Right.
And,
Right. Just,
and one day you're like, okay, like you don't even have to
cross
think
your
about
fingers and ask somebody for help.
it. Right, right. And I think that's like the huge thing is knowing what you don't know and feeling comfortable in that and asking and knowing who your resources are.
Right.
But so I reached out to several people who had recently posted about needing subcontractors, and one of them needed one. And that's my personal injury subcontract. It's like a full service medical litigation firm.
Right.
So I do that.
Nice.
And then again, same thing. Somebody had posted in Facebook they needed a subcontract, and I responded. Didn't hear anything for a while, and then got an email a couple months after that. But as far as other marketing, I'm very new on LinkedIn, so I'm just trying to get that set up. And I've reached out to other LNCs to kind of build up a community of resources. And I've started to slowly reach out to some attorneys that way.
Yeah. I like people that subcontract. I mean, I like everybody, but it's always better to have your own attorney client if you can get there.
Yeah.
You
I
know,
think
take subcontracting till you can.
Yeah, I think, the thing about nursing is that we care for people and we like that sort of human connection, and subcontracting is great. Like I don't have too many complaints about it. It's just I miss that like connection. I miss that partnership.
Right.
I like working as part of a team, and I want to know, you only get so much of a snapshot, and I guess that's my goal in this is to become part of a team. Yep.
My other question is, and you may be a part of this, are you on the LNC exchange at all?
I'm not.
I highly recommend that. And it has nothing to do with me. I don't get a penny from anybody. It does cost a membership. I have zero interest in I have 100% interest in it. It's a great platform, but I'm not associated with it and don't profit from it. It's it's a news group. It's loaded with LNCs from around the whole country. Sometimes I assume there's thousands. I'm not sure how many, but it's a place where nurses who are looking for subcontractors post their needs there.
Okay.
So I might even put that in the chat here. LNC Exchange. Why am I getting coughs here? We're cold. LNC Did I my glasses? Did I spell that right? Yeah. No, I didn't. EXCANGE.com. Oh, come on. So it's a good place to find other nurses that are looking for subcontractors. So anyway, that's a place to go. A lot of nurses who are looking for DME subcontractors are in there as well. They're from all over the country.
Yeah.
So I recommend that. Other than that, marketing. The other thing about marketing, this takes a lot of confidence. I'm all about the drop-in.
Okay.
Take a drop into that. You put some nice clothes on, grab some business cards, go to Canva and make some little nice, publication about yourself. Yeah. Walk in, talk to the gatekeeper, ask if there's somebody available to, you introduce yourself, tell them what you're about. And is there someone that may be interested in hearing about my services? 99%, you're probably going to be told no, but it does work occasionally. And when they tell you no, you leave your stuff. And then 2 months later, you might be shocked and you hear a phone call from them. I like the drop-in versus the cold phone call because you're in front of them. They see who you are. You're not from overseas trying to sell them something. You in that essence. So that's my other marketing tip.
Yeah. I think there are several firms in my area, so I'll have to definitely give that a try.
And you never know. And do you are you familiar with any attorneys at all in your whole life, even if they're not med mal personal injury?
Yeah, I've got a couple friends who are attorneys, and I don't know if they're not medical or do anything with med mal or personal injury or anything like that. And so they've offered to pass my name along, but I don't know if outside of like a personal injury or med mal,
Right.
if other attorneys have a whole lot of experience with working with LNCs. And so, yeah.
I always encourage people to even talk to an attorney that has nothing to do with it, because yeah, they can refer you along, but then also they can tell you like what their opinion of your chances are, or like, yeah, I know 5 guys that seem to already be looking for nurses, or I've never heard of that here.
Right.
And there's pros and cons of both. Sometimes, it's good that you hear, they're using nurses, but that's competition. But then on the other side, when no one's using nurses, I say, well, then that's the time to create that avenue in that area,
Right.
and show that.
Yeah, I don't know a whole lot. And I think we talked about this already. A whole lot of other LNCs in my area, but I am planning on going to. There's a conference here in a couple weeks.
Oh yeah, tell me about the conference. Give the whole details.
Yeah, so it's called Inside Litigation, and Lori Brown is putting it on. So it's a 2-day conference here in Indianapolis, the first week of April. So I'm looking forward to hopefully meeting some other LNCs there and possibly making some connections with some attorneys.
What city is it in?
It's in Indianapolis.
Oh. And the first week of April.
Yeah, I think it's like a Wednesday, Thursday. I'll pull up my calendar real quick. Yep, it's April 3rd and 4th, actually. It's a Thursday, Friday.
I'm going to put it in the chat here. Thursday and a Friday. It's a 2-day.
Yeah.
There we go. So anybody, you don't have to stay overnight since it's not too far.
No, yeah, no, it's actually just like 15 minutes from my house, so it'll be nice to go for the day. And I think there's a dinner later that evening, and then you go back for the next day.
I highly recommend any conference that's not going to break your budget, but
right.
This sounds really nice because I go to I've went to one, but I plan on going to more ALNC conferences.
Yeah.
And just the networking with other LNCs is just worth it alone. It's a great experience. And I think this will get you involved in some other LNCs that are there, and maybe, some connections can happen that'll get some business going for you and whoever else.
Yeah, I hope so. I think, even if it doesn't, I think it's just nice to have just like that touch point with somebody who else is in the field, or somebody like, even attorneys who have worked with LNCs, just to kind of learn from them and what it's like working with an LNC.
So anybody who's heading to Inside Litigation, April 3rd and 4th in Indianapolis, look up Erin and tell her she's more than happy to say hi and hand you her business card.
Yeah.
So
I'll get mine printed.
Well, you got a little time.
Yeah, that time to prepare.
I would highly recommend, if you do any conference you go to, you should have some cards on you, because
it's on my to-do list. Yeah, that's
I would come home with pocketfuls of cards from people that I see the name and I had a nice conversation with them, but it's so many people that I forget who they are.
Yeah.
The card helps me remember who they are. So, well, all right. We've been at this 20 minutes. So you're outside Indianapolis,
Mm-hmm.
and any attorney out there. Well, let's review one more time. You have worked the ICU,
Mm-hmm.
the emergency room,
Mm-hmm.
and what about transplants?
Yeah, so multivisceral transplant, like liver, small intestine, kidney. Yeah.
That could be a specialty in the legal nurse world that's not heavily saturated with nurses.
Okay. Yeah. And then so my ICU experience is pediatric ICU. So I also got a exposure to the NICU. I would float down there a lot, and then actually had some experience in the newborn nursery, so on postpartum floor.
Oh wow!
And it's funny. People always ask, like, were you so nervous working in the ER and the ICU? And I think the most terrifying place I've ever worked is in that newborn nursery.
Yeah, they're so new.
Yes, very new, very
Yeah,
new. And yeah, so my, they're healthy, normal babies, but I'm so used to having something not
right.
wrong, but medically wrong. So I was always like pacing back and forth.
I bet that had to be nerve wracking. People used to say to me, and like, "Oh, are you really nervous working in the ER versus like med surge or being up on tele?" I'm like, not really, because I've always got a doctor to turn to,
Right. Yeah.
who's standing like 10 feet away, and I can drag him
Right.
in on something going. Where if you're on a unit floor or something, you got to page, you got to help they call back, you got to help a hospitalist jumps in the elevator, comes down.
Right. Yeah. I think that's something too, is, the ER is very special. I feel like sometimes, like, people feel like there's like a hierarchy, and I mean there is,
Oh, totally.
but in the ER it's very cohesive. Like your physicians and your nurses, you're all a team, and it needs to be a well-oiled machine. So there's definitely mutual respect in there. Um, so that's, I miss that part of
I
being
bet.
bedside.
Yeah, I would totally understand that why you would miss that.
Yeah.
So, well, all right, we've been at this for a good 22 minutes. We reviewed your skills for any attorney out there and especially in the Indianapolis area. If you're a Indiana attorney and you've never sent a registered nurse to an independent medical exam, call Erin. She's took my
Yeah.
training. She has me as an avenue if for anything that she might need. But if she's already more than competent enough to attend your client's IME, and if that's new to you as an attorney, call Erin and tell her that, and we'll both
Walk you
make a
through it.
presentation,
Yeah.
on the benefits and how it works.
Yeah.
To any other LNC out there, Erin took my course. Getting one of the I don't well I'll say perks, or one of what you
It
get
is a
if you
perk.
purchase
It
my
is a perk.
course
Yeah.
is appearing on this show, and you get to, and this is on my LinkedIn, this is on my YouTube channel, and this is going on Facebook. So your name would get exposed if you're on this channel with me at some point. And if you're interested in my course, email me, or you could just go to medicallegalconnection.com and /training will get you that. And other than that, Erin, you got anything else that I'm forgetting?
No, I just enjoyed speaking with you and kind of sharing a little bit about me. And yeah.
All right. Well, thanks for being on. And I look forward to talking to you more as your LNC career goes on.
Yeah, I appreciate it.
And we'll have a great day.
Thanks, you too.